no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare and Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, we're back. It's Gil Lederman. I want to talk about a 59-year-old black diabetic woman whose mother died at 45 of breast cancer. So now this woman, 59, has breast cancer. We know that black women have twice the death rate from breast cancer as others. Why? Not getting to the doctor on time is the most likely reason. This woman got to the doctor. She actually has a small cancer found on mammography, about a centimeter, well differentiated, no lymph node involvement. She was seen by doctors elsewhere who advised her extensive chemotherapy followed by radiation. We saw her. She is very reluctant to have chemotherapy, and I think she's right. She has an early cancer, no lymph node involvement, small. We know the data that shows benefit for lumpectomy and radiation to save the breast and to have a better chance of being cancer-free. In fact, data now shows that women who have lumpectomy and radiation and save their breast are more likely to be alive, cancer-free, than if you have the whole breast removed. And I know lots of people think if you remove the breast, you're going to be better off. No. Actually, the recurrence rate is higher than with lumpectomy and radiation, and you can live your life with the breast. For most women, I'm not talking about every person, I'm talking about most women. We know that if you live your life with the breast, cosmetically, you'll be intact. Reconstruction cannot create what God gave you. And having that breast in your normal body will let you psychologically more likely get over the hump and get back to your normal existence in a good way. In the good news department, we have a black man also, 65 years old. He came to us with a PSA 9, Gleason 6 cancer. He just finished up his treatment at Radiosurgery New York for prostate cancer. And his first PSA with no hormones, nothing else, just our focused beam treatment, 0.93. So a very quick fall in his PSA, very favorable results, and actually prognostically very, very positive for him. He's fully intact, sexually intact, urine life intact, and his PSA has dropped already by 90% with our focused beam treatment. So if you're considering prostate cancer treatment, you might want to give us a call. We have a completely new prostate booklet. with prostate cancer data, our data versus other major centers, proton beam, surgery, robotic. It's all in there. We'll send it out to you at no charge. You're welcome to do so. And here's a man with prostate cancer. He's from upstate. I treated him 10 years ago for prostate cancer, and now his PSA had dropped from 9 down to 0.04. He's a barber in upstate. He's planning to move to Georgia to be with his children. He is fully intact. He's 70 years old. He makes love every week to his wife. He's done it for decades. He's fully intact. His urine life is intact, and his PSA is 0.04. He's in complete remission after treatment in the stereotactic body frame with brachytherapy by us 10 years ago. And in our booklet that we will send to you at no charge if you call, you will see that there's patients out there 10, 15 years if you've tracked PSAs and what happens to PSAs. By the way, speaking of the controversy about what happens when government starts mixing in health care, there was an article this week by Daniel Kopen, who is a professor of radiology at Harvard, refuting the information about mammograms. He said that the Obamacare task force started out trying to reduce health cares by eliminating mammography for women in their 40s, starting mammography at age 50. This started in 2009 when Obamacare was being developed. Actually, the pushback was so great that that aspect got stopped. But now there's fights about breast screening. And in this article, which was published in Wall Street Journal this past week, the recommendations about mammography comes even though the task force models show as many as 100,000 women in their 30s could be saved by annual screening if you had screening starting at 40 who would otherwise die by waiting till 50. So the public outcry has been great about this planned pushback of starting mammography from 40 until 50. There's scientific data, including large randomized studies, that show that screening for breast cancer saves lives, he reports. Screening began in the United States in the mid-1980s, and in 1990, the mortality rate from breast cancer, which was unchanged for 50 years, began a steady decline. Today, there's 30% fewer women dying of breast cancer than would have died if they had that 1990 death rate, which continued. How many lives are saved? It's about 15 to 20,000 lives saved annually. So, yes, treatment is better, screening is better. If you're a woman, you may want to look at the data before you make your decision about getting mammography, and give us a call if you have questions. And speaking of calls, we have a caller on the line. Good morning. You're live on the radio.
Hi, Dr. Lederman.
Good morning.
How are you?
No, excuse me, just 1 minute, Sally. Hold on. We're happy to send you a booklet. Just call our business office Monday through Friday, 9 to 5, and we'll put a package in the mail to you.
Oh, no, that's beside
Sally,
that,
you just got to wait a
I
minute. I got two calls at once, so please, Sally, wait. Okay? So for the prostate cancer booklet, call us Monday through Friday, 9 to 5, same number, 212-CHOICES, and we'll put a package in the mail. Okay?
Okay,
Thank you. God bless you.
My friend has
Bye-bye.
a problem in his brain.
Sally, good morning.
Yeah.
What's up?
Hi, doctor.
Yes.
I'm so glad to talk to you. I believe
What's
you
your
me.
question, Sally?
Doctor, I have a friend. He went through chemotherapy. It got him very sick. And I was telling him to listen to WR to you because that you were advanced.
Well, you have to listen to Dr. You have to listen to WOR at the right hour.
What?
You have to listen to WOR at the right hour.
Yes, I know that.
So what's your question today, Sally?
I want to make sure. Well, I think he's in his fourth stage. He got tired of the chemotherapy. You know, he said he couldn't take it no more. And I kept listening to you on the radio, and I told him about you. So, you know, I would like him to come down there and see you. And you told him. I told him you're like what you said. It's like the patient's the president, which you said, which is
the patient is the
highly
president of the United
intelligent. There's
States
a lot
of his
doctors
body
that
or
don't
her
do
body.
that. What, doctor?
The patient is the president of the United States of their body. The patient gets to hear the options, and the patient gets to decide which treatment to have, right?
Yes. Well, he's got, like I said, he's in a stage.
Okay, well, just have him give us a call, 212-CHOICES, which is 212-246-4237. Again, it's 212-246-4237. Give us a call. We'll make an appointment, get him in quickly, and give him all the best options possible, okay?
Oh, yes, doctor. And if you could send me your CD, too.
We will. Just call that number, 212-CHOICES. Call us during the work week, Monday through Friday.
And he could come in right away?
We promise to see within 24 hours, okay?
Okay, that's great.
Thank you. God bless you.
Okay, bye-bye, doctor.
Bye. Thank you so much. I want to talk about a rare disease. A man came to us with ameloblastoma, which is a tumor from the teeth. So I've said before, actually, just yesterday on our program, that most any part of the body can develop tumors and cancers. And this man has a huge mass in his mandible, so you might see him down the street. It looks like he's sticking out his tongue at you, but it's not his tongue. It's a big mass of tumor called ameloblastoma. He had surgery in New Jersey. The doctors cut off the mandible. They cut off the tumor. They told him he was going to be okay, and now it all grew back. He heard about treatment options with us and radiosurgery, and we gave him all the options, including surgery, radiation, and others, and he chose to proceed with focused beam treatment for ameloblastoma, a rare disease, and we have a lot of experience with rare diseases because so often standard treatment doesn't work. We treated tens of thousands of patients. So this gentleman, we are starting treatment this week, and we'll report back to you about the ameloblastoma. But most probably, no guarantees, but most probably it's going to stop or shrink. And how do we know that? Well, we follow up our patients. We follow on a regular basis. Now, we just had a woman talk about on the phone, you just heard it, that their brain was affected by chemotherapy. Well, in fact, there's an article out this week from May 27th that shows brain activity changes after chemotherapy, in an article by Catherine Doyle in Reuters Health. For some women with breast cancer, activity in the brain changes after chemotherapy with reduced mental functioning, and it may be what's called chemo brain. Cognitive complaints of people increase with chemotherapy, and we're trying to find out why, said Sabine Depress in the new study. Difficulty multitasking is one of the biggest complaints. So they compared women before and after chemotherapy, as well as women who weren't getting chemotherapy, and they found an increased complications with multitasking in the women who had chemotherapy. And also, they did special MRI testing of the brain called functional MRI, and they found that women who had chemotherapy were having changes in their brain. So are there changes possible from chemotherapy in the healthy brain? Yes, there are. You may want to look at the article, but it seems like you might want to limit chemotherapy if there's other options. That's part of the beauty of radiosurgery, that we can focus in, hit the cancer without hurting healthy tissues. So again, radiosurgery is totally diametrically opposite to chemotherapy. Chemotherapy goes in veins and ends up from head to toe, spreading to healthy tissues and otherwise, whereas radiosurgery is focused on the cancer. We're going to hear from our sponsor, and then we'll be right back.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom tailored for you.